Hello, everyone. My name is Dane Christiansen at the Health and Medicine Council, and welcome to the Waha Warriors 2026 Advocacy Update. Today, we're going to cover what's happening on Capitol Hill. We will be primarily focusing on issues impacting medical research, impacting patient care, and this new conversation on affordability and how we can use that to advance our legislative agenda, raise awareness as a rare disease community, and ensure that our policymakers continue to work for us. Before we talk about moving forward, though, we should probably talk about successes and progress from last year. So last year was 2025. It was the first session of the 119th Congress. So we had a new Congress convene, and we also had a new administration, which was, of course, an old administration. Donald Trump was the first president since Grover Cleveland to be elected to two non-consecutive terms. But that just means we already had a little bit of preview of what the administration was going to be like. And there's a little bit of information on how to be successful in advocating in both of these environments. And I'll mention right off the bat, one of the things we know about the administration is they like to use what Teddy Roosevelt referred to as the bully pulpit. They like to go in front of a podium and make a lot of pronouncements about policy decisions. But the thing to remember is we have three separate co-equal branches of government. We have the White House and the administration, we have the courts, and we have Congress, our senators and representatives that work for us. And the system is set up in such a way that the White House can say an awful lot, make a lot of policy pronouncements, but really, if anything is going to get done, it goes through Congress. Laws are made there, policy is made there, and ultimately it's your senators and representatives that have the final say in what happens or doesn't happen. And of course, they're probably a little bit more interested in what you, as their constituent, have to say than what the White House does. So just remember, your voice counts and your story matters, and meeting and engaging with your senators and representatives has a big impact. Don't believe everything you see on TV in terms of what's going on in Washington. The system is still the same one we all know from civics class in seventh grade. And that means when it comes to how much funding for medical research or what bills are getting passed into law, that's the work of your two senators and your representative. And it doesn't matter what their political affiliation is or yours, because the issues we discuss are not politicized. They're simply raising awareness. How could somebody work on behalf of the WAHA community if they don't know anything about WAHA or the patient experience? So, really quickly to level set, Congress had a few priorities for last year. They wanted to pass the One Big Beautiful Bill Act, or H.R. 1, which is a budget reconciliation proposal. And that means that it just requires a party line vote to pass, not the normal bipartisanship required for any other law, but it can only be focused in a narrow area. These are 10-year bills. They focus on mandatory spending and a couple of key things. There were coverage and access changes in Medicaid. There were work requirements and things similar to prior authorization put in. There were changes to SNAP benefits, Supplemental Nutrition Assistance Program, and I think increasingly people are aware that nutrition and health and disease are all very closely linked. And there were changes to student loan caps for doctors at medical school. And I mention that because, of course, we have an awful pronounced healthcare shortage in a number of rural and underserved communities. And if it's harder to train doctors because they can't get loans, then that's going to be harder to change that access. And I mention that because Congress sometimes works in one size fits all solutions, like when they say we need to cap student loan payments. Might make sense if you're going for a degree, I won't name any, at the risk of offending anyone, and say, geez, this was an awfully expensive degree. How is my job supposed to pay for this? But of course, that doesn't apply to medical school, even though it would almost apply anywhere else. So sometimes there needs to be nuance and some of these solutions brought forward. And that's usually true in the rare disease space as well. Research or patient care can be unusual. So it's important that they know why a one size fits all solution isn't a good idea. And the best way to advance that is with your story and with what you need. But this is a 10-year bill. Most of these things are phased in later, and Congress will revisit them before the implementation date. So there's always a chance to advocate, even though something like this seems like it's been done. But I know there's a lot of press about that. That's the story with HR 1. We did have the longest government shutdown, 43 days, I believe. And it was over something that happened in HR 1. It was the expiration of premium tax credits to help keep insurance policies purchased in the exchanges affordable. People were mad about this. They said, my healthcare costs are too expensive. This is crazy what I have to pay now. And Congress had moved on from this issue. But once the voters said this is unacceptable, then their senators and representatives took notice again. So now affordability and affordability in healthcare has become the word of the day. And healthcare is once again something that Congress is focused on. And of course, patient stories for how their insurance works, the treatments that are available to them, research going on in their area is what lawmakers care about as they look at this affordability conversation. And then Congress completed 11 of the 12 annual spending bills on January 30th. They passed a big, what they call a minibus package. One bill is still hanging out there, so it's prevented some progress on fiscal year 27 work, the next funding cycle. But Labor HHS, which funds research and patient care, and also the defense program, which has its own research program, those bills are enacted. That money has been given to the agencies by Congress, which has the power of the purse. One other thing I want to mention is the administration had a lot of bold ideas that they wanted Congress to pick up. They wanted them to cut medical research at NIH by 40% and consolidate agencies into one new Make America Healthy Again, or AHA agency. This was the administration's budget proposal, but when Congress passed that spending bill on January 30th, they didn't do any of those things. So even though it was a Republican White House and a Republican Congress, none of those proposed changes coming out of the White House were made. And that's because Congress has the sole ability to spend money, and Congress makes final funding decisions, and they listen to their constituents when they make those decisions. So instead of cutting NIH by 40%, the NIH had a $400 million funding increase. Not the biggest increase in the world for medical research when your budget is about 48 billion with a B dollars, but of course, much better than a cut. And once again, the voices of academic researchers and patients are what carry the day here. Also, public health agencies were not consolidated into a new agency or had otherwise diminished. Congress prefers business as usual. So all those agencies, the CDC, others are just were funded as the same as they had ever been, with their funding lines intact and the work they've normally been doing moving forward. The VA research program, the Veterans Administration research program, had a modest $2 million increase, but once again, not a cut. And the DoD, the Department of Defense medical research program, which we advocate for, because it could potentially include acquired hemolytic anemias moving forward, with enough advocacy, had its funding fully restored. So $850 million was added to that program to take it from $650 million up to $1.5 billion. A very robust investment. There were also a number of policy riders that were put into the bill to push back on interference in research. They said we're going to keep something called indirect cost policy about how much academic institutions can spend on research, the costs that are needed, like running the lab, that can go into that. And there were also restrictions on something called multi-year funding, which would diminish the amount of investigator-initiated research that can be done. And that might be okay if you're major cancer centers, but if you're a rare disease, fewer funding opportunities likely means fewer grants. It hits you harder than it might hit a community that has many, many grants that are available. If we lose grants, it could be the only two that are actively funded. There needs to be a change there, but restricting multi-year funding will help with that. There have been concerns over the lack of leadership at NIH. The NIH director was recently announced that he would be leading the CDC as well. The NIH is in Bethesda, the CDC is in Atlanta, so this will be difficult for anybody. But Congress is saying we want to make sure that the CDC and the NIH both have an awful lot going on. And Congress also said we want prior notice if any grants are going to be canceled for any reason, because of course the money that's getting canceled goes to the lawmakers' states. It goes to the researchers there, and it benefits the patients that are there. So this is all Congress being responsive to the concerns of constituents. They also made a few policy changes in the bill and passed laws that we care about that had been languishing out there. They enacted a 2-year telehealth extension. They enacted a bill called the Kids Access to Care Act, which lets children in the Medicaid and CHIP program see doctors across state lines without going through a bunch of red tape. And it enacted the Give Kids a Chance Act, which is a bill about rare disease treatment development that also includes a reauthorization of the FDA's priority review voucher program. So a bunch of good outcomes at the end of the day in the FY26 appropriations. And even for us specifically, I want to remind everybody advocacy works. Congress had included what they call report language in those spending bills previously. They had asked to do more work on WAHA specifically through the Rare Blood Disorders Program. And they tried to increase funding from 10.4 million to 21.1 million dollars for the public health approaches to blood disorder program to let there be more work in public health in this area. The report language is adopted. So the NIH is under a mandate now to do more research into WAHA, but they didn't have the ability to add the additional money. When they level funded, the money for the public health approaches to blood disorder program stayed at 10.4, but hopefully with a little bit more advocacy, it can get doubled to that $21 million level and start new activities for us. We already have new research now starting because of the work that was done to advocate for this report language. This is Congress responding to you and saying, we're going to tell NIH to do more research in this area. Now, if we could get a little bit more funding, there'd be even more resources to support that work. And once again, this happened because your voice matters. This didn't happen because anything else. It was because constituents talked to their senators and representatives and said, we need more research funding, we need more public health going on, and we need you to support certain bills. This is what drives the process forward. The administration might say, well, geez, we wanted to spend less on research and more in a different area. But Congress, who writes the bill, said, well, we take input from our constituents, and we've heard from a lot of people that we need to do more research and more public health. And also, we heard from some of our advocates in the rare blood disorders community that we need to do more work in warm autoimmune hemolytic anemia. And that's what they've told the research agencies to do. We need to build on this foundation and keep making progress. So what's going on with Capitol Hill today? Congress is now focused on the FY27 appropriations process. They are trying to write the spending bills as quickly as possible, with the exception of the one that is still hanging out there, which is the Homeland Security bill. And they're asking for input on what they should fund. And I'll get into that in just a second. They are particularly focused on what their constituents are asking them for this year because it's an election year. So in November, everyone's going to go to the polls and vote, and they want to make sure that you are happy and on their side and know that they're working for you. So these requests are very sensitive to the offices right now. And Congress is also going to be focused on patient care legislation, another big package like that one we just talked about, that's going to include provisions on affordability. It's going to include provisions potentially on something called pharmacy benefit managers reform. This is about lowering out-of-pocket costs for you. Congress years ago tried to vertically integrate the supply chain in healthcare. The idea was if everything was incorporated together, then prices would come down. It would be more efficient. This didn't happen. Prices went up. So now they're trying to fix the errors in the system. And they're also trying to reform a program called the 340B drug discount program to make sure it can appropriately give discounted medications to people in need. There will be broader conversations about policy changes that affect everyone in the rare disease community and all patients, and then also opportunities to make specific progress on things that particularly are relevant to us. But if you want to engage in this process, the best way to do it is not by leaning into any political talking points. It's by simply saying what your experience as healthcare has been. Were you surprised how long it took to get diagnosed? Were you surprised there weren't more treatments available? Were you surprised at the lack of public health information? Were you surprised about your out-of-pocket costs or how your insurance works and feel you've been treated unfairly? These are the best, clear, honest, and true messages to give to lawmakers. In many respects, they know that you are your own best advocate and you have a pure self-interest. Others have an agenda, but you know what's working for you. They also want to know what's working for you so they can make policy changes and fill in those gaps where things are not working very well. So what are we going to be talking about for 2026? We want to build on things in medical research and public health. We are going to be asking the Department of Defense peer-reviewed medical research program to include acquired hemolytic anemias on the list of conditions deemed eligible for study. This is a $370 million pot of money, and a condition can only compete for a share of that money in research if they are on a list that appears each year that deems them eligible for study. Your senators write that list. Senators need to request the inclusion of a condition because it has a military service connection and because their constituents have asked them to. We want you to ask them to, and we have information on the military service connection. But you should have every expectation if you ask your senators to do this and open up a new avenue for research, they will respond. We asked last year. They were sensitized to the request. Our hope is we would be included this year now that all the money has been restored and the resources are available to support additional conditions being included. We are also asking for more research through the National Institutes of Health. The best way to do that is with more money. More money funds more scientists, and we don't fund very much science right now because even though the numbers sound big, this is all the conditions under the sun. So we and everyone else in the patient community are asking for $51.3 billion for NIH, which is an 8.5% funding increase. And this should hopefully expand our rare disease research portfolio. There's another entity called the Advanced Research Projects Agency for Health. They are very similar to NIH, but they approach research a little differently. They identify a problem and then they devote resources to simply solving that problem, like the military might work on researching something. They're currently funded at 1.5 billion. We are asking Congress to increase that funding to 1.7 billion. Once again, 200 million would allow a lot of additional research to get done. We also have some asks on the public health front. We would like the CDC budget to be increased to $11.58 billion. This is roughly a $2 billion increase to bolster public health. There's been a lot of talk about fighting chronic disease and pediatric chronic disease. While CDC has the Chronic Disease Center, the best way to do that is to simply plus up that budget. The CDC needs more money. Public health clearly not funded at the same level as research. There's also a program there that can specifically benefit the Waha community. It is called the Chronic Disease Education and Awareness Program. It funds cooperative agreements to do things like provider education and public awareness and surveillance in condition-specific areas, including rare diseases. That program is currently funded at $4.5 million, which funds about 15 different projects like this. We want Congress to increase that money for $2 million by $2 million to 6.5 annually. We believe that may even allow them to have enough resources to support a WAHA specific project. We also want them to provide that funding increase for the public health approaches to blood disorders program. They proposed a $10 million increase. Money is tight. So we're asking them if they would do a very reasonable increase of $2 million to bring it up to 12.4 million annually. So they can always provide more, but we don't want to ask for too much and have them say, geez, we just can't get there. So we want to build on what happened last year and say, okay, now with a more favorable funding environment, please make good on this funding. Even a modest increase would allow them to do work on additional rare blood disorders, including ours. And then finally, there's a bill we support called the Clinical Trials Modernization Act. It's HR 3521. It's to allow more folks to participate in clinical trials and get around some of the barriers that are commonly faced, like confusion over compensation and time off of work and things like that. So the most important thing is to make your voice heard. We have an action alert right now that is on the DoD research program. We would very much like you to contact your senators in support of that request. I'll give you some information on how to do that in a moment. We also are writing testimony to the House right now. That testimony is going to make these asks officially, and we would like to include patient stories. So sharing your story will be very helpful. Congress knows the numbers. They need to know why we're asking for it. We also want to help raise awareness. Even telling your story and reaching out to these offices, make sure more members of Congress know who we are and what the condition is. It's a very safe bet that most of them don't. Even if they're on a healthcare committee, how much do they really know about different rare diseases? We're going to give them that information. If you want to know more about how you can participate in other opportunities and resources that are available, you can attend the 4th annual patient meeting in Tampa in May. And then you can also volunteer if you're really interested in advocacy to come to Washington, D.C. in September to share your story with your Senate and House offices in person with other patient advocates from the community. So really quickly, if we want to co-sponsor the Clinical Trials Modernization Act, We just simply need to tell people to become co-sponsors. It's a bipartisan bill, so any Democrat should support it, any Republican should support it. And what's going to happen is Congress is going to do a lot of work now up until July. They're going to work on the spending bills and they're going to work on the other legislation and healthcare, and then they're going to take a pause and they're going to go campaign for the year. The November elections are going to happen, and then they're going to come back for what's called a lame duck session in November and December. And in that time, they're going to pass as many bills as they can. So the more members that know why legislation like this matters, the easier it will be to pass this bill at the end of the year in the lame duck session. If we don't, you'll just have to start the process over next time. And if you want to share your story, any story is helpful. All stories matter, but we are particularly asking for folks to share their stories with these offices that are listed in the House of Representatives. If you're from one of these states, then your Congress member is on this subcommittee that directly decides how much money NIH is getting, how much money the CDC is getting. We want you to add your story, brief, however helpful, to this testimony to help make sure they know that they're helping their constituents. Very important. And then if you do want to reach out to the Senate, your two senators, and ask them to include us in the DoD research program, any two senators can help. But these senators listed are the states that we are specifically looking for. Once again, these are the senators who will write that spending bill and directly decide what goes on the list. So this is particularly important. And if you are saying, geez, I would love to help, how do I take action? If you want to respond to provide your story for the testimony, or if you want to take part in that DoD outreach effort to the Senate, simply email Josh Fein at the Health and Medicine Council, FEIN at hmcw.org, Hotel Michael Charlie Whiskey. We will respond to you if you simply tell us who you are, what you want to do, and give us your zip code so we can look up your members of Congress or your state if it's your senators. And then if you are interested in attending the Tampa meeting or the DC Hill Day, please simply reach out to Karen Jones. We are looking forward to celebrating Awareness Day very soon. So thank you for joining us, and please expect more guidance on how you can help raise awareness. Thank you.